Thank you very much for the warm welcome to Colac, and I can't tell you how happy Pip and I and the ANF staff are to be here. You're the first cab off the rank on Sunday, I think, when we announced we were scheduling our meetings, and we desperately wanted to make sure that we came to regional Victoria. We're not a metrocentric union at the ANF, and we want to make sure that our country members are well represented around that negotiating table. We do know about your ratios and about how desperately we need to improve those ratios, not just at Colac but other hospitals at your similar size, because we do recognise the growth in births that you've had, the growth in emergency department presentations, the growth in inpatients that you've had, the expanding community that you are required to care for, and we want to make sure that we get improvements for you out of this enterprise agreement. A little bit about why we're doing the community rallies. We feel that it's absolutely critical that our communities understand about what the dispute's about. Many of you will have heard comments on the television or on the radio about nurses going back to work, and I'm very at great ends to say to people, but they never left work. And of course we didn't go on strike. Our industrial action about closing beds, in fact, often makes it more palatable for our patients to get cared for in our hospitals when that takes place. The other thing I think that the community often focus on is about that our dispute's about a pay increase. And yes, we want a pay increase, and we're not ashamed that we want a pay increase, but the critical thing about our dispute is about maintaining and improving our nurse-patient ratios. The reason you become a nurse or a midwife is because you want to make a difference. You want to be in a sector that's actually a service sector that actually adds to the value of the community's life, and that you advocate for patients and that you make a real difference. And that's why we became nurses in the first instance. But at the same time, we don't want to be taken advantage of and therefore not paid what we're worth. If we were paid what we were worth, we certainly couldn't be afforded by any government. But it is quite critical that we do get a significant wage increase during this dispute. But importantly, our issue is about making sure that we grow our workforce, that we make sure that we have a strong regional Victorian workforce as well as a metropolitan workforce, and that we make sure that nursing is attractive for our students to come into. And if we end up with a workforce that can't give the quality of care that it wants to, that goes home at the end of every shift feeling that they haven't done what needs to be done, then the job satisfaction goes, and when the job satisfaction goes, then nurses go as well. One of the things that we want to make sure is that our public health system in Victoria doesn't revisit the 1990s. In the 1990s, thousands of nurses were forced out of our profession. They were made redundant. Many of them worked agency, and our public hospital beds were closed permanently in very, very significant numbers. And we don't want to return to that. We need our public hospital beds open, and we need to make sure that we've got nurses caring for patients when they go into those hospital beds. There's no point having a hospital bed open if you don't have a nurse or a midwife there to care for you, because that's the very reason that our community goes into hospital, to make sure that they get safe care and quality care, and that's what we want to be able to deliver. If I can just take you back a little bit, we've been negotiating now with the state government and the VHIA since June of this year. It troubles me that Mr Baillieu thinks that we have to have at least 60 negotiating sessions before we can reach agreement, because what we say to Mr Baillieu is it's not about the quantity of the negotiations, it's actually about the quality of the negotiations. And we've had over 160 hours of negotiations, and in addition to that, another 220 hours of document preparation for those negotiations. So we have been working extraordinarily hard since June to try and put forward a position around the negotiating table on your behalf that doesn't compromise your capacity to care, that is going to ensure that there's a fair wage increase, and ensure also that the terms and conditions of your employment are terms and conditions that can benefit the government, that can help the government save money. There is room there for savings, but the savings cannot be at the expense of the hours that nurses are working. So the things that are between us are this. First of all, we have had no discussions at all since June in relation to wage outcomes. That has not been discussed for 1 second. The second thing is that we have, of course, put forward our claim in relation to improved nurse-patient ratios, and that claim has been totally rejected. It was last rejected on the 1st of December, last Thursday. What the government want, of course, is they want unlimited 4-hour shifts. And what we say about unlimited 4-hour shifts is that, number one, it is awful for nurses because you have to work more shifts to get the same income, and you'll be more tired. And the problem also, of course, is that it will undermine our nurse-patient ratios. So the government ministers are saying, but we want nurse-patient ratios, but don't believe them, because the only thing they want about nurse-patient ratios is the ink on the paper that sets them out. Nothing that they are offering or they are seeking protects actually the application of those nurse-patient ratios. What it means is that instead of having a nurse looking after you, the community, for 8 hours, you'll have a nurse only for 4 hours. And then one of the nurses who remains for those 8 hours will have twice as many patients to care for. In a hospital like this, that means that you'll have nurses at some stage of the day who will be responsible for up to 8, 10 and 12 patients in your acute ward, and that's not safe. The other thing that the government want is that they want to introduce split shifts. Now, I'm about to turn 50 next week, but even I don't remember split shifts. But there are older nurses who speak to me about split shifts. And what split shifts mean is that you come in, you do a couple of hours, and then you go home, kids off to school, race down to the supermarket, come back to work, do more work, go home, pick up the kids, put the dinner on, hope your hubby comes home, feeds the kids, you go back and finish off the shift. I say that that's not very family friendly, and it doesn't induce work-life balance, and it's not good for our patients. Our patients don't want that nurse fleeting in and fleeting out and fleeting in and fleeting out. We need continuity of care. Continuity of care of our patients leads to safer outcomes. Already, many of our patients don't know who the nurse is on the ward. Yet when we wear our red t-shirts, we're easily identified, and many of our patients have said, keep those red t-shirts on, at least I know who the nurse is. So we can't ever agree to short shifts at 4 hours for any bed-based services. There are already 6-hour shifts that our hospitals can access for those nurses who, for family reasons, may need to work a shorter shift. But 4-hour shifts, we believe, compromises care. We think split shifts with the distances that particularly our regional nurses are travelling will not be conducive to working, having to go home and back and home and back. So these things aren't possible for us to agree to. In addition, of course, we know that the hospital wants greater flexibility around nurse-patient ratios. But what we're concerned about is that the hospitals don't use already the flexibility that is there. We don't have the same ratio in every ward. We have different ratios in different clinical areas. There is already flexibility. There is already a capacity for hospitals to, with consultation with their nursing staff, if they're keeping the same number of hours, they can move those nursing hours onto different shifts to accommodate the different workloads at different times. We don't need any more additional flexibility that totally undermines our nursing work and totally undermines the care that our community expect from us. So these things aren't possible, what the government wants. In addition, of course, there's the skill mix issue, and it's a critical issue. All of the nursing research, both in Australia, both overseas, in Canada, in America and many other countries, all stipulates and finds that when you reduce the qualification of the nursing staff that work in the health facility, the patient outcomes are worse. The infection rate increases, the sepsis increases, the pneumonia increases, the falls increase, the pressure ulcers increase. All of these things which lead to a greater length of stay of our patients, which actually makes our patients sicker in hospital for longer periods rather than getting better quickly when they come to hospital. And we can't ignore that nursing research. You need to have more qualified staff to make sure that our community is cared for safer, then that's what we want. And so we are saying no to unlimited numbers of health assistants as part of our ratios. What the Federation has offered is to have assistants in nursing in addition to our nurse-patient ratios, not as part of nurse-patient ratios. Our nurse-patient ratios always have to be made up of registered nurses, of registered midwives and enrolled nurses. But what we say that in our workforce there is room for us to employ undergraduate students of nursing, enrolled nurse trainees, and help support and mentor those students to get them out of the retail sector, to get them out of the McDonald's, and to ensure that when they are working, to support themselves through their university days. And we know that 93% of our undergraduate students are in paid employment of some sort during their undergraduate degree. And so what better thing to do than to bring our undergraduate students into the fold, bring them into our nursing teams, bring them into our models of care, bring them into our hospitals as assistants in nursing, supporting the nurses and the midwives, the very nurses and midwives that they will be working with when they graduate. Because what the research shows is that that means we have a more confident graduate, we have a more competent graduate, we have a better orientated graduate, and someone who is more experienced and who understands, once they become registered, what it is to be a nurse, rather than registering and thinking, oh my God, I didn't know it was going to be like this and it's not for me. And so it's critical that we nurture our undergraduate students and bring them in with us. Not with direct patient allocation, that's not fair. As I said, our nurse-patient ratios, they have to be about having registered nurses, enrolled nurses and registered midwives, because it's our registered nurses who take on that legal responsibility for the care of the patient that's in our hands. It's them that has the duty of care. It's their registration that's on the line. And so that's quite critical. So we can't have unlimited Certificate 3 health assistants in nursing. We can't have them as part of our nurse-patient ratios, because what that means is that if you have that, then you have less registered nurses, less registered nursing hours, less enrolled nursing hours, and less midwifery hours. And we can't afford that. And our patients, for their sake, we can't afford to give in on that either. And so we are going around Victoria, Pip and Paul and I. We're off. We've been the Royal Melbourne and the Women's obviously on Sunday. Yesterday it was Monash, Clayton and Maroondah Hospital. Today we've been at Barwon. We're here at Colac. Paul's gone down to Gippsland and he's at Latrobe and Sale. Tomorrow I think we do Frankston and the Alfred. Thursday we're somewhere else. Friday we're at Wodonga and Mildura and Ballarat. Saturday we're at the Royal Children's Hospital and Wangaratta. And it's absolutely fantastic, the support that everyone is showing, not just to us but to you, the nurses. And I think it's so critical for us to be out in regional Victoria because, you know, Pip and I are country girls ourselves, and we understand what it's like to fundraise for your local hospital. We understand that every local hospital isn't a public hospital that's owned by the state government, but it's a public hospital that's owned by the local community, and that's absolutely critical. And we want to help grow that local community hospital, and I know that you want to help grow your local community hospital because, particularly being part of the community, you have such an extraordinary sense of ownership, not just of your facility, but of your ability to care for the local community who are very much a part of the Colac Township. So thank you so much for having us. We are going to stay fighting to get our enterprise agreement. It's going to be a very different fight this time. But we are absolutely going to win, and we are not giving up until we win. And so what I say to you is make sure that you stay with us for the ride. This is your enterprise agreement. We want to make sure that the care that you can give is better than what you want to do, and make sure that it's safe that you're going to do. We can't do it on our own. We're wonderfully supported by thousands and thousands of nurses and midwives who are our ANF members, and we're very, very proud to lead you in this campaign. We will work, we will do whatever it takes. We do know that we should be around the negotiating table. We're not around the negotiating table, and if we can't be around the negotiating table, then there's no better place than to be here. And we're going to make sure that everyone around Victoria understands what our dispute is about, and making sure that, you know, the sacrifice and the concern that you have for the community is really what's uppermost in our minds. And you're to be congratulated for your stance, for your strength, and for your support, and for the, you know, the reason that you're out here today, and we very much appreciate that. We have written to the hospital CEOs and directors of nursing, advising them that of course we're coming. Can I say hats off to your Director of Nursing. She is at this stage the one and only Director of Nursing in this state who has welcomed us and asked to meet with us after the rally. And so we do hope that we think that's a fantastic thing, and I am looking very much forward to meeting with Eldred, because we are concerned that some of the things that are being said on your hospital's behalf around the negotiating table may not necessarily reflect actually what your hospital wants. Does your hospital want you all working 4-hour shifts unlimited? I suspect not. I hope they're as concerned about the travel time that you spend on the roads and rather than on the wards caring for patients. Does your hospital want to, you know, have you working split shifts? Does it want less nurses? I hope not, and I'm confident that that won't be the case. So it's important, you know, that we also make sure the idea of the rally isn't to drive a wedge between hospital managements and their directors of nursing. That's not why we asked them to come down and address the rally. It's important we know that we all work together, whether you're the hospital management, whether you're one of the nursing staff, or whether you're the ANF organiser, to make sure that we all work together to make sure that we've got a strong workforce and a happy workforce at Colac Hospital. And so we thank her for that, and we look forward to meeting her shortly. There are issues around the negotiating table, as I've said, the sorts of things that the government are wanting. We think there's a real disconnect. Certainly the Premier has made comments that we are particularly concerned about. We're concerned that he says that this dispute can be settled through negotiation when it's really the employers and the government's reason why we're not at the negotiating table, because they are so intransigent in their position, and Commissioner Gooley felt that there was no point going on at this stage. We do have proceedings before Fair Work Australia next Thursday. We are seeking an application of a breach of good faith bargaining, because all of our meetings, all of the documents that we've received very strongly make us believe that the government and the VHIA are bargaining in bad faith, not in good faith, and we can't get an agreement unless they're pulled into line. And so we will be keeping you updated through our regular updates about how those proceedings are going. But thank you very much for having us all here today. Some afternoon tea, and I hope that you'll stay and mingle and we can have a talk with you all and nurse some new babies. We all like nursing new babies. And thank you very much for the community for coming out to support the nurses here today.